is responsible for managing zero waste and other waste-related matters at the City of Victoria. I'm not going to do a lengthy introduction because you can read it in the materials. Rory, you can add to that all the things I should have said and didn't, and we'll turn it over to you.
Okay, fantastic. Yeah, I'm going to start. I'm excited to be here. This is it's my first time probably ever really presenting to a crowd of public health practitioners and people in that field. Interestingly, when I was finishing, I did my undergraduate degree in geography with a focus on GIS, and before I went on to my graduate work, I was contemplating two fields. One was the epidemiological field, and the other was urban sustainability. And obviously I went to urban sustainability, but that public health and epidemiology were certainly high of interest at that time. So it was interesting, 15 years later or whatever, to be coming back and sort of seeing how these two actually intersect. So I'll start sharing my presentation here.
Just while we're waiting for that, Rory, just for the other folks from public health, I've said for donkey's years, and I had a friend who was a sewage worker in Toronto, that the most important public health professionals are actually the people who provide clean water and manage wastes. And we forget about that.
That's right, yeah. I know the practitioners in our area doing that definitely think of it as public health, and I think there's a growing understanding of that sort of triple bottom line sustainability of these things. There's a need to address environmental, social, economic aspects of these sort of core municipal services. So I've got it up there. Everybody can see it. Looks good. Just perfect.
Yes, that's good.
Okay, I'm going to minimize just the side screen so I can see my slides, and I'll bring everybody up again so I can see faces in a sec. So yeah, thanks for the introduction, Trevor. I'm the manager of sustainability asset management at the City of Victoria. Got kind of a diverse portfolio here. I think the relevance is, the biggest relevance is I've sort of helped to establish and I now lead our waste reduction initiative at the city. So it's a new area for the city to be tackling. Traditionally, and probably still quite commonly in municipalities, most of the waste-related activities are focused really on operations and the collection and the providing of solid waste services. And Victoria's amongst a group of growing number of municipalities across Canada, especially in BC, who are really identifying their opportunities to reduce waste, as well as just the sort of collection and more operational considerations. I should mention as well, Trevor talked about the underground utility consideration. So when we talk about waste in a municipal context, in the legislation even, there's sort of a division between municipal solid waste or solid waste and liquid waste. So I'm focused here on solid waste. There's lots of practitioners here on the city who do liquid waste, so largely our sanitary sewer infrastructure, stormwater infrastructure could be part of that. There's definitely an overlap as some of the solid waste gets washed into our storm sewers and enters the ocean, so there's definitely some overlap there as well. But I'll be focusing the remainder of this presentation on solid waste, or municipal solid waste as it's often referred to. So flow of waste in our communities. This is actually a draft graphic that we've just produced as part of Zero Waste Victoria. So it's our strategy to guide us towards the reduction or elimination of waste in our community. Really the point here is to show you the main sectors and materials that we see responsible for the generation and disposal of waste. So shown here tonnages. About 90,000 tons a year of material coming into the municipality. A relatively equal share between residential there in orange, commercial purple, and construction of who takes and disposes that waste. And then you can see the type of materials coming out of that. So composted materials, recycled materials, and landfill materials. And really big thing to show here is that the majority of the material that's ending up in our landfill is recyclable or is organic and could be composted. So there's zero waste is maybe considered an ambitious target, but when you look at these materials and the qualities of them, the majority, except for maybe some hazardous materials or household hygienic materials, most of them should be able to be composted or recycled. And all these different materials and sectors who are responsible for this have different considerations when it comes to the environmental impacts of those. And I should note here as well, we can track what goes to landfill and what goes to recycling and compost in a decent way. A landfill, we've got good tracking. What we don't know is what enters the environment. So this isn't necessarily a full comprehensive picture, because we know a lot of waste is actually escaping all these streams and entering into our environment. So it's a bit of an unknown. I think the stats we use in Canada is 1% of plastics enter the environment. But again, these are very rough estimates. We don't have good understanding of what actually enters the environment. And I'll get into some of these questions or considerations when I talk about plastic pollution.
Rory, can I just clarify, is that for the city of Victoria or for the region?
Yeah, that's a good clarification. This is actually the city of Victoria. So we don't usually collect this type of information as a municipality. It's in BC anyway. The regional districts have legislative responsibility for solid waste planning. But this is part of our strategy, is trying to understand within the jurisdictional boundaries just of the city of Victoria, what are the different sectors and what are the different materials, and we use this to inform our municipal policies or actions that we're taking. So yeah, this is City of Victoria. And City of Victoria, again, through this analysis, we contribute, although we're about 1/5 of the population in the region, we contribute about 1/3 of the waste to the landfill, largely as a result of obviously all the commercial activity in our downtown core. And then just for the breakout of that, when we look at the actual waste or the going to landfill at our Heartland landfill here in the region, about 1/3 of that is food or the packaging that we have around our food. And then we further break down, and this is sort of the term used in the industry, avoidable food waste versus unavoidable food waste. So avoidable food waste is essentially food that could have been eaten. So, a half-eaten hamburger, for example, still edible breads, dairy, that type of thing. Unavoidable food waste is really the stuff you can't really eat. So that's, eggshells, banana peels, that type of material. And again, food packaging, a substantial amount of food packaging as well. So 1/3 of all the materials going to our landfill is food or the packaging used to hold our food. And then just shows we've got, the City of Victoria does also collection in the public realm. And as you would expect, a large amount of food packaging as people are, drinking coffee or taking their sort of meals to go. And that's actually, we're noticing anecdotally that's higher as a result of the current pandemic, as people are using more sort of takeout services and eating those in the public and using our infrastructure for that. So again, kind of close to equal share of avoidable and unavoidable food, and then a lot of food packaging. So what are the environmental impacts of this? I'm going to talk about the environmental impacts of food and of the packaging itself, and there's a lot additional I could say here, but when it comes to food, I think by far the biggest environmental impact of disposed or wasted food is the greenhouse gas emissions. So when that organic material reaches a landfill, or when it enters somewhere where there's no oxygen, so in an anaerobic environment, that organic material turns into methane, which is a very powerful greenhouse gas. And then there's further greenhouse gas implications as you move up the supply chain as well to produce and distribute that food. What you're seeing here is a graphic which says, okay, so what do we do with this wasted food? How do we intervene in it? And it shows the impacts from greenhouse gas emissions of different interventions. And you can see by far the biggest impacts are either preventing that food from being wasted or redistributing it to people to consume and to eat. Massive impacts there on greenhouse gas emissions. And we know globally the disposal of food into landfills or unmanaged landfills in a lot of cases globally is one of the biggest impacts of greenhouse gas emissions we see globally, and a huge opportunity to reduce those emissions, as well as addressing some of the social issues. So we'll get into that, or health issues. When it comes to packaging, this is a newer field for really understanding the environmental impacts. And I'm really going to talk about plastic packaging here, as it's been definitely a growing area of concern globally and locally. So I've actually just pulled some of the environmental impacts out of a recent report that was done by the federal government, released in January. So it was a bit of a meta-analysis of the current literature on environmental impacts of plastic pollution. And I've listed kind of the main ones that report identifies here. So the top two here are largely macro plastics, or large plastics. So that report has identified entanglement of wildlife, as well as sort of even plant life, which results in harm in a lot of cases, or mortality to that wildlife. Again, the ingestion also can lead to harms, physical harms, or mortality as well. There are potential ecotoxicological effects of plastic packaging to the environment, but the science is not very clear on what those are yet, or is not aligned yet to be able to quantify the impacts of that. There's identification that especially microplastics may act as transport for other chemicals. Again, emerging science here. A lot of this is actually very emergent science in understanding the impacts of plastic. And then the other one there, especially again for microplastics, is that it may be a habitat for microorganisms, which may include potential pathogens. I think the biggest area that there probably for the last decade, and even the last couple of years, there's been a much better understanding of just the prominence of microplastics and other plastics in the environment. And I think the science is really trying to now understand what those environmental impacts are really going to be long term. But we know it's everywhere ultimately. So those are the environmental considerations. What about the public health implications? So when it comes to food loss and waste, I think by far the biggest public health implication is just the ability of that material, wasted food, to feed people who need it. So I've just shown the graph here of household food insecurity in Canada. It's growing and it's quite large. So if we look at the sort of the three categories of food insecurity, 13% of Canadian households, people living in Canadian households, are in an insecure, food insecure situation. That's huge, and that's Canada. It's worse than a lot of other countries as well. Here in actually the Greater Victoria region, it's actually a little bit less than that. Saw the numbers, I don't have them exactly. I think it's closer to 6 or 7%. So we are doing better than the Canadian average, but obviously, still a lot of households who don't have secure access to food. And then the public health implications of plastic pollution. Again, as I sort of mentioned before, is an emerging area of research, but this is pulled directly from Canadian Public Health Authority and or agency. You guys know better what the A is. So there's definitely a lot of impacts with the production of plastic. That's where a lot of the toxic implications are for public health. There's direct toxicity in some of the materials or components in there, including lead, cadmium, and mercury. They're identified carcinogens, and there's also endocrine disruption, which has a lot of potential implications there. Again, a lot of this is definitely well understood and demonstrated to have a substantial impact on health during the production, and science is catching up to understand actually the use and you know, the prominence of microplastics in our systems. What are the health implications of that, and can we demonstrate that? So CPHA's review though of that. So the rub, here's where the two come together, and this I think is a really interesting challenge and thing to think through as we consider both food waste and packaging waste. I'll talk through this graph a little bit. So this is a report that came out of National Zero Waste Council recently, and the analysis was done by Value Chain International, which is a fantastic organization leading and summarizing this type of research. And it's showing the role that packaging plays in reducing food waste. So again, the packaging serves right now a purpose in reducing food waste. And so showing there the different orange bars, I want to just maybe point out the sort of the keeping the food fresh longer, decreasing damage. That again helps prevent food waste, and as well as, you know, there's certain items there where the food safety as well helps reduce the food waste. So I think one of the things to show here is that, you know, packaging does play a big role when it comes to preventing food waste as well as keeping food safe. That's more the case though in obviously meat and dairy. So when we get to other more shelf-stable foods, that packaging maybe has less of a role in keeping it safe and lasting. But yeah, so packaging helps prevent food waste. So how do we still reduce that packaging waste as well as maintaining that sort of food reduction? So this is my last slide before we go into questions, and really just talking about some of the community opportunities. So in the literature and in industry, they talk about food loss versus food waste. So this is kind of an important distinction or definitions to understand. Food loss is basically everything that happens during the production, transportation, and sort of processing, manufacturing of food, essentially from the farm to the processor. Food waste is what happens essentially after it leaves the processor and gets distributed grocery stores to grocery stores, and then ultimately consumed in the end. And I would note here that where communities and municipalities fit into this is more going to be on the food waste side of things. So that's, you know, once the food enters our communities, what are the opportunities there to intervene and to address the issue? And I've just got some actually photos on the bottom that represent some examples of opportunities to address food waste, so that 30%. Well, the first one there is actually a photo from the Food Rescue Network here in Victoria. There's food rescue networks across North America. They work closely with grocery stores and food banks to take edible food that can't be sold on the shelves anymore and to feed food insecure communities locally. The middle two photos are actually an initiative called GoBox, and it's probably the leading reusable takeout container service. They're out of Portland right now, and they're expanding quite quickly into different communities, and ultimately it's a take back container service where you can use the container and deposit that used container back at a number of locations around the municipality, where it then gets commercially cleaned and sanitized and given back to the food service establishment to package that food. And then the last photo there is an initiative that the City of Victoria is a founding partner in, which is called Love Food Hate Waste Canada, and it's an initiative largely sort of social media and education campaign to help households be aware of food reduction tips. So saving, planning out your food, keeping the food fresh that you have, and reducing the waste ultimately of your food. So that's the end of my presentation. Hopefully that gives some good food for thought for starting the discussion. And these are our questions for discussion, but maybe I'll just go back and open it just to general questions or clarifications that anybody may have. I'm going to stop sharing my screen here too.
Thank you very much, Rory. And the field is open. If you've got a question, put your hand up or wave at us or something. A question or a comment.
Hey, Rory, I'm just going to switch screens here and put up the notes I've got so far. So, and I'll just load those.
Do you want to just show us that final slide, Rory, that shows the
Sure, yeah, my mouse just froze there, sorry.
We've got about 20 minutes for discussion, then a few minutes to condense some key ideas. So what are the key implications for public health and personal action? And who are some of the unusual allies you might need to work with? That's what we're suggesting people focus the discussion around, but of course, it'll go where the discussion goes.
It sounds good. Would you like me to keep those up, or can I?
No, if you release them, then Chris can put his notes up as he starts.
Okay, excellent.
Is everybody seeing the notes now?
Yes. Okay, so thoughts, comments, questions, anybody? Any of you working in the area of food waste in particular, or zero waste more generally?
See, Jocelyn has her hand up saying yes. There's some people saying yes.
Yeah, I mean, I wasn't going to say anything, but I'm just, some of the work that's being done around here, and it's been like kind of boosted forward with COVID, was work on like gleaning and like getting local teams of support out to gather food from trees or crops that are, don't have the farm support to use the things that might go bad in the field, especially because we had a kind of a migrant worker crisis, as you all likely know. Interestingly, though, as we're working with some of the new caremongering sites that are happening around here, I was educated a lot about dumpster diving and how that's a strategy that people are using to fill their food needs. And it just really awoke me to just the amount of usable food that was in the dumpsters behind conventional grocery stores, and how people were very, of course, careful because it was like a resource for them. So those are just some of the thoughts that I had as I was listening.
And Rory, there's a couple of questions from Claudia in the chat box. One is, and they're both from her, what are the incentives to reduce food waste in Victoria? And are there any programs to promote changes in public behavior around food waste and packaging?
So sure, I'll start with incentives. I would say there's no incentive necessarily to reduce food waste. That's a bit of a problem, and that can be sort of direct incentive, but also, there's more garbage cans than there are composting in our public realm. So it's easier to dispose that waste in the garbage than to do anything else with it. We do have curbside collection of organics. So that goes to a composting facility, but that's, again, it's collected at the same level as garbage. So there's no necessarily push to compost. I think, with the city, we're looking and exploring where we maybe have more regulatory authority to require, especially when it comes to the commercial sector, to restaurants. We know multifamily buildings as well are not as good at diverting this food, so we're looking at more regulatory options to actually require the diversion. And then the second one was education campaigns or behavior change. Was that it?
Yeah, and any program to promote changes in public behavior.
Yeah, so I mentioned Love Food, Hate Waste. That's it's a global campaign right now. It actually came out of the UK through RAP and was very successful there in having real tangible impacts on food waste reduction. So that's the biggest one we have in Canada right now, and we're subscribed to that and finding new opportunities to get that information out. And it definitely has a different or direct overlap with current pandemic, and we started to get some education material out. Again, keeping your food fresh longer in your fridge helps reduce food waste, but it also helps you avoid trips to the grocery store, unneeded trips. So that was a big push, and the city's looking for more opportunities to do that type of thing. I would say a lot of our major grocery retailers here in Victoria are participating in the Food Share Network, which is fantastic. So that's an established process to get that food to the network to be able to get redistributed. But there's absolutely a ton of food still wasted. So how do you do that at a smaller scale? How do restaurants participate effectively? And how do you scale that up? I think is a big question.
There's also then a question from Stephanie about how much recycling are we actually processing in Canada as opposed to being processed outside of Canada or North America?
And another great question, and it differs from province to province. So here in British Columbia, we've got probably the most comprehensive extended producer responsibility program in North America. What that means is that the producers of products and materials are ultimately responsible financially for the collection and recycling. As a result of that program in British Columbia, we have a very healthy plastics recycling infrastructure and processing facilities, largely in Vancouver, Merlin Plastics. They're actually all across Western North America now as well. Paper, despite the forest industry here, is not as strong. Actually, all of our paper was going to China until they put in their new material ban. So they're just reestablishing North American markets for recycling paper. So not as good. So so recycling of plastics and paper is good in BC, and there's regulations and legislation around requiring that, but lots of problems with packaging. So most packaging, especially plastic packaging that you see around food, is the material composition or components of that are unknown. We're seeing a lot more multi-laminated different types of plastic. Really can't be recycled. Straws, forks, compostable plastics is hugely problematic because it fouls up all the infrastructure. So plastic recycling, from our point of view, is good for PET bottles. But film plastics, if it's sort of a LDPE, HDP is good too, except it sort of, again, it can gum up infrastructure. A lot of it ultimately is garbage. It fouls up the process, and it's hugely problematic and in many cases unnecessary. So we're trying to find alternatives to that plastic.
Hi there. We have a couple of questions that are on the chat as well. Just let me scroll down. Do you have any advice for influencing regional districts? Do you have experience collaborating with public health to initiate action through regional districts?
It's an interesting question. So the avenue of going through public health to regional districts, we haven't necessarily explored that. We work closely with our regional district. Again, we're a member municipality and in the CRD. We participate in their solid waste planning process. We work very collaboratively here in Victoria. And I think there's a huge opportunity, and I think it's really exciting where we are in Victoria to better understand the municipal tools and authorities for addressing waste. So I would say the waste management has fallen on to regional districts because they own and operate landfills in many cases, and the legislation requires that regional districts be doing that planning. But the tools they have are at the very sort of bottom of the sort of pollution prevention hierarchy. They're basically landfill bans or tipping fees on the material that goes to the landfill. That's what they can do. So I've tried to come up with an analogy. I haven't come up with one yet, but it's like, driving a massive ship and you're at the back, you're trying to steer this thing. I think, municipalities have potentially more innovative tools to address waste reduction in the first place. So we introduced a checkout bag regulation that was overturned in the courts. We took it to Supreme Court of Canada, and they held up the BC Court of Appeals decision. But again, there's more opportunities to be exploring some of our tools around business regulation, around regulating nuisances, and also municipalities do the collection service in a lot of cases as well. So how do we evolve our collection service to be addressing some of these things and to be reducing waste? And I think working with regional districts is massive opportunity, and I think municipalities testing and finding authorities that they have to address waste reduction is massive as well.
Next question is...
Can I just jump in on that one? I've just put a message in the box, so I won't elaborate too much on it. But since a number of our audience are in health authorities, in addition to regional districts, we should recognize that health authorities are major sources of waste. A lot of it is not clinical waste. A lot of it is not dangerous waste, hazardous waste. And health authorities should have their own waste reduction and recycling programs, and if they don't, then they should be looking at them. Check the Canadian Coalition for Green Healthcare for details.
Great, yeah, thanks for that. I mean, so that was another part of the question. We have been working with representatives from our local health authorities as well. I think a huge opportunity when it comes to when it comes to food safe, and if the business is going to be moving and introducing like a reusable take-back container program, for example, like GoBox, what are the impediments to sort of rewriting their plans and to doing that on a sort of case-by-case basis? Is there a sort of a more blanket approach that the health authority could say, here's sort of how you use reusables, and instead of each food service business who, a lot of them are always just sort of stressed for time and to be making changes are very difficult of that nature. How do we make it easier? How do we reduce the barriers to that? And I think, Trevor, I like that comment as well. Definitely from a waste practitioner space, there's a real perception that any sort of health related waste you can't touch it, right? It's all necessary. And I think understanding from that field that actually there are opportunities to address it. It's massive in terms of a generator of waste in our community, and nobody wants to touch it in this field because they just assume it's all sort of health and it's way outside of our understanding, and we just won't go there because perceived risk. So.
Next question I have is, what are the implications of UV treatment on safety and food waste? Are the plastics collected in the last slide sanitized and reused? If so, what are the changes to the plastic with heat and sanitizing chemicals?
Yeah, I can't actually answer that in a great amount of detail. I'd have to have one of my staff answer. So I assume you're talking about the plastic reusable containers. They're made, I think, of polyethylene. So if anybody here has an understanding of the implications of polyethylene, my understanding is that's potentially more recyclable plastic. It also doesn't absorb greases as much as other plastics. And so GoBox uses, I believe they use polyethylene containers. They're sort of put through sort of commercial dishwashing procedures like sort of any other sort of item that food service would have. and then dried and then redistributed. So I look to others here to understand, are there implications of that? My understanding is it's a sanitary process, and should be perceived as quite clean. So. Any other questions, Chris?
Oh, pardon me. I'm just checking here.
I'll throw one in while you're doing that, Chris.
Yeah, sure. That seems to be most of the questions I've got presently. I think the online comments are kind of answering themselves to a certain extent. There's an active online discussion also going on.
The one I've just posted, Rory, I remember many years ago reading about Austria had a packaging tax. And so for every layer of packaging, so when you get something in a bottle wrapped in plastic, put in a cardboard box and stuck in a bag, you pay a 5 or 10 cent tax on each layer of packaging. Why don't we try that here?
Yeah, I think it's an interesting, I mean, I would say that there's perhaps for materials that are covered under EPR, there's a more implicit price being put on that. So again, by requiring that the producers collect a certain percentage of that, they have to pay for that. So it's sort of embedded into the price of the item. I think it's an interesting idea as a municipality as well. I think we explored it with our bag regulation. We required that businesses put a fee on paper bags. So we outright banned plastic bags. We required a fee on paper bags, again, to give that signal to the customer that there is value in this product and to try to switch their behavior, ultimately to be bringing their own reusable bags. So I think whether you call it a tax or a required fee is something that a municipality can actually maybe put in place. And it's something I know Vancouver was signaling that they might be doing that for cups and takeaway containers. And it's certainly on our radar as a potential intervention we could take when it comes to food packaging especially. And I think the other value of that is then we don't want to be the ones that necessarily introduces, reasonable take back container. We don't think that's the city's job, government's job. But if we can shift the market or create a space, try to address some of the externalities of the current disposables by putting a fee on it, it provides an opportunity then for a third party to come in and maybe introduce a program that would be more cost competitive than, paying 50 cents for your coffee cup every time. Chris, I must say, the ability to sort of see all this and move it around is great.
Yeah, I've got a personal question here to jump in on. In light of COVID, I know you were just discussing about the healthcare industry, and it may be seen as outside of our purview, but that certainly seems to be changing under the new pandemic, in that people are now encouraged to have disposable masks and gloves that they're wearing, which are ending up in municipal systems. And I know there's been a few announcements by the mayor to please not flush your masks down the toilet, and it seems to be a realm where the municipality and other partners seem to be entering into how do we manage medical waste, in that we have a lot more of it now coming out.
Yeah, it's a great question. So the medical waste, I think there are opportunities. The question of where the municipality intervenes is very difficult, right? The idea of intervening at this point right now, the municipality doesn't have jurisdiction or even capacity to address health, right? We are often at the end result of just sort of cleaning up this material. One thing we've done as a city ourselves, though, we've introduced for our street cleaning and our janitorial staff, we've got special boxes that they put their nitrile gloves into to be recycled. So there's, people may be aware of TerraCycle. It's a amazing company based out of Toronto, but they operate across North America. They've focused, their niche is hard to recycle items. So we actually send all our cigarette butts that we collect to TerraCycle right now. And we've collected, I think, like 10 million cigarette butts in the last couple of years since introducing the program. Now we're collecting nitrile gloves and sending those to TerraCycle. And we're also actually trying to identify, as a city anyway, how we could use reusable masks. So we know there are reusable masks. I think Canadian Linens provide some. The question is it, the concern of, somebody getting a reusable mask, just like you get maybe, reusable towels or something, are they comfortable using that mask? So I think there's some work to be done there. I think there's lots of options. I think it'd be interesting, again, if, like a sort of Canadian Linens mechanics outfit, like a jumpsuit, if it had your name on it, it was your mask, you get a few of them and it has your name on it, it gets cleaned and returned back to the city, might be an interesting option. And then I think, Chris, as well, you mentioned sort of the medical waste implications. And then gave some examples of maybe how large institutions can be addressing it, just taking a proactive approach to finding recycling options or reusable options. But we're also being faced with the question of what to do with single-use items. And, I think there's just a knee-jerk reaction to assume that plastics and disposable items are more hygienic or sanitary, where I don't think that's been shown to necessarily be the case. There was actually a letter that was just signed by several hundred sort of health practitioners, public health practitioners globally that, is saying that reusables are safe. And I think it's about process, not products. Again, lots of grocery stores here, load it into your cart yourself, right? It's the process. There's ways to do this safely. And I'm sort of, at what point do, the city was taking a fairly aggressive, not the right word, strong regulatory approach to single-use items. At what point do we get back into that? At what point is both the science giving us enough and the evidence giving enough confidence that disposables don't necessarily provide any safer option when it comes to COVID than properly using reusables in a safe way. And I think the biggest thing there is just the sort of almost the social license or just the perceived risk of the public. At some point, I think the public probably is going to be seeing the mountain of garbage and wants to be addressing it. Are they going to be convinced by the evidence that says, we can still use reusables safely? It's we talk about daily with my staff, so.
If I could just jump in here, I'm watching the clock. We've got 5 minutes and 20 seconds left before we're booted out of this. What we would like to do is get some sense of what are the key messages that people are getting from this. Could be something that surprised you, something you think was really important, something that you didn't even know. Something you really want to commit to taking action on yourself. But what are some key messages that we should take back to the large group? So either put them in the chat box or just speak them out. We're a small enough group that we could probably get away with that. So key messages, folks.
Yeah, I'd love to hear people speaking. I know that people have been entering the chat box, but great just to sort of see faces and hear voices. So those who are entering the chat box, feel free to unmute.
Hi, everyone. I think the thing that spoke the most to me was how much of the items going into the landfill are actually recyclable and compostable. That was devastating to me.
Okay, thank you. And Chris, you're going to put those on a summary slide somewhere.
Yeah, I'm just having a technical difficulty presently because it's not showing me the slide I want to put up. So I'm just trying to fix that issue. I'll be with you in just one moment.
Okay, just want to make sure we capture those. Other people for key points?
I I think one of the key points that I'm taking away is that there is a lot of really good work happening, and that if we were to pay more attention globally and in North America, that there's a lot of success stories that can be modeled in other regions.
That's good. Do we have somebody who's going to report back? Is that my job? Or Trevor, do you want to do that? Oh, we got booted. Did we get booted? No.
We could, is that if anyone?
No, I'm still trying to fix a technical issue here.
Yeah, we'll leave you working on that. I'll take some notes as we go. So it'd be good to have a volunteer to report back. If not, one of the three of us will do it. Other thoughts? What other key lessons have you learned? What other key points do you think we should take back to the main group?
I'd also be curious on the sort of unusual allies piece of that as well. I mean, I imagine, you know, we have our usual stakeholders, but I'm very curious from a public health, like, you know, who seems unusual to you, or even, I mean, it says unusual, but usual. I mean, who are your usual allies that I should be aware of as a municipal practitioner when it comes to waste?
Hi, it's Monica Vanderleest. I'm with the Public Health Agency of Canada. And one of our programs is a Canadian prenatal nutrition program, CPNP. And one of our other children's programs, Canada Action Program for Community Action Program for Children, as well as Aboriginal Head Start, they are all dealing with food insecurity. So one of the things that, I mean, it comes up again and again for all of the funding recipients and projects across Alberta and BC, and I think across Canada. One of the things that I thought was interesting is the public health implication of the food that is not available to feed people, and the 13% of families who are facing food insecurity. I thought that was a pretty interesting link that certainly FACT should be paying attention to.
So sort of food redirection. For those of you who work in healthcare, I don't know to what extent you've looked at your own health authorities' policies around food waste or waste in general, and recycling and waste reduction, but it's certainly something that's within your own professional and organizational competence to look at. And if you don't know what they're doing, you might want to find out, and you might want to take a look at the Canadian Coalition for Green Healthcare and the work they do on this.
I just heard or saw Stephanie say ally schools, and it's interesting too. Is this is just kind of, I don't know if it's unique to Victoria, but we actually have a joint contract with our waste collector with the school district and the city. And so we can sort of together through that joint contract actually push for better source separation or additional requirements. So there's actually an interesting direct link there between the school district and the city because we're using the same service providers.
Okay, we're about to be kicked out. Chris, I'll send you some notes because I picked up a couple of things you didn't catch. According to the note there, we should be out of here any moment now. Any other final thoughts? If not, put them in the box. We're now going back to the main session.
Thanks, everybody.